Hello, everyone. Welcome to today's webinar hosted by Engage, the National Resource Center for Engaging Older Adults, which is administered by US Aging. My name is Rebecca Levine, and I serve as the Senior Program Manager of Engaged at US Aging. Our webinar today is called Physical Fitness and Social Engagement, Strategies, Activities, and Partners. During the webinar, YMCA of the USA, the National Council on Aging, and the National Recreation and Park Association will spotlight strategies for ways organizations can use physical activity as a hook to promote and encourage social engagement among older adults. Speakers will also share examples of potential partners for collaboration at the local level. Next slide. So before we get started, we do have a few housekeeping items. All attendees of this webinar are in listen-only mode for the duration of the webinar. So that means that your microphone or your phone will be muted, but there are still ways that you can engage with our speakers today. You can submit questions for the presenters at any time during this presentation by clicking the Zoom question and answer or Q&A button at the bottom of your screen. Type your question into that Q&A box and then submit, and then we'll have time at the end of the webinar to address attendee questions. There's also the chat feature where you can click the chat button at the bottom to submit a message to the host if you need technical support. And then finally, this webinar will be recorded and will be available on the Engaged website early next week. Next slide. So for those of you who are using a screen reader and want to silence unwanted chatter in the chat and Q&A boxes, you can activate the speech on demand feature by pressing Insert, Spacebar, and then pressing the letter S on the keyboard. You can view closed caption subtitles, watch a live transcript of the meeting, or adjust the size of subtitle text. And to control closed captions, you can click on that CC or closed caption button in the control bar at the bottom of the Zoom window. You can also notify us that you'd like technical assistance by raising your virtual hand, which you can either use the Zoom platform to raise or lower your hand, or press Alt+Y on your keyboard. Next slide. So I also want to share a little bit more about my organization. US Aging is the national association representing and supporting the network of area agencies on aging and advocating on behalf of the Title VI Native American aging programs. Our mission is to help older adults and people with disabilities live with optimal health, well-being, independence, and dignity in their homes and communities. US Aging has a number of initiatives that we administer or lead beyond Engaged. So this includes administering the Aging and Disability Business Institute, co-leading the National Aging and Disability Transportation Center with Easter Seals, leading Dementia Friendly America, and operating the Elder Care Locator and the Disability Information and Access Line, among many more efforts. And you can visit our website, usaging.org, to find out more information about these initiatives and our other initiatives. Next slide. So Engaged, US Aging administers Engaged. We're the ones who are convening today's webinar. Engaged is a national effort funded by the Administration for Community Living through a cooperative agreement. And we're working to increase the social engagement of older adults, people with disabilities, and their caregivers. Much of our work focuses on identifying and disseminating information about emerging trends, developing resources and related materials for aging network and partner organizations, and compiling best practice examples of social engagement programs. We're guided by a project advisory committee with representatives from 18 organizations and resource centers who provide social engagement insights from their field of expertise. And all three of the organizations presenting on today's webinar serve on the Engaged Project Advisory Committee. You can learn more about our work on our website, engagingolderadults.org. Next slide. So here again is our website and our social media handles, as well as our email. So feel free, to connect with us on social media. And if you have any questions, you can reach out to us via email as well. Next slide. Okay, so now for the exciting part, I'm pleased to introduce the fantastic speakers that we have on today's webinar. Heather Hodge, Senior Director, Equity, Access, Engagement, and Health Approaches with the YMCA of the USA. Jennifer Tripkin, Director, Center for Healthy Aging with the National Council on Aging, and Sina Macris, Program Specialist, Health and Wellness with the National Recreation and Park Association. So with that, Heather, I will turn it over to you.
Thank you. And thank you everyone for attending today's webinar. And if you're listening to this in the recording afterwards, we're happy to have you with us today. My name is Heather Hodge, and I'm with YMCA of the USA, and happy to share a little bit about what we're doing to help strengthen community through physical activity and social connectedness. So if we can go to the next slide. If the YMCA is new to you, just want to share a little bit about how we're structured. So we are a federated nonprofit network. There are approximately 772 YMCA 501c3s that make up our network, but they represent about 2,600 YMCAs across the country. So we have some statistics here, help you understand a little bit of our reach. And older adults are one of our fastest growing membership groups that we have. So excited to share a little bit about what we're doing in this space today. Next slide. The next slide talks about how the Y really looks at impacting community health. So we use the socioecologic model as well as a public health model to look at the opportunity to not only impact individual health, but what are all of the policy systems and environmental opportunities for us to impact health across a continuum. And to do that both in terms of health promotion, prevention, and management of chronic disease. So happy to, again, share a little bit about what we're doing in this space today and how it relates to supporting older adults through social connectedness and physical activity. Next slide. Let's start with physical activity. So one more slide, please. We, every year, YMCAs complete an annual report, and they report to us what they're doing in a wide variety of domains. But in the health and wellness offerings, I wanted to be able to share our 2022 annual report data here with you. So you can see, and this is specific to work with older adults. You can see here that we have approximately 1,800 of those 2,600 YMCAs who offer some sort of physical health programming, social gatherings, mental health programming. You can kind of see this across the spectrum here, as well as food programs and even adult daycare services. Our next slide. We also offer the option, you may be aware of the YMCA as an in-person organization, but one of the things that the public health emergency did was really push us to start looking at what are our opportunities to engage in remote delivery of programs and services. And so YMCA 360 is another example of the types of services that are available for adults who may not live near a YMCA as an opportunity to be engaged in supporting health improvements overall. Next slide. And then in addition to some of the physical activity programming, we do have also a portfolio of chronic disease programs that really are focused in on helping youth, or in this case, the majorities are focused on adults with lifestyle behavior changes to help improve health overall. We partner with Sound Generations to support the scaling of enhanced fitness across our network. We have a cancer survivorship program called Live Strong at the YMCA. We work in falls prevention, both with enhanced fitness as well as moving for better balance. We have a hypertension management program through the YMCA's blood pressure self-monitoring program. And then we also have YMCAs who are delivering the diabetes prevention program. So just wanted to share a few of the examples of these types of programs as well that can also help adults increase their physical activity as well as improve the social connectedness. Next slide. So let's talk a little bit about some of the social connectedness things that YMCAs do. So one more slide. This is looking at slightly older data. This is really just before the public health emergency, where we were trying to get to a little bit more detail on the types of social programming that YMCAs might be offering for older adults specifically. So here you have some data. We are refining what the annual report questions are. So we'll have a little bit more data based on 2023 numbers. But in this case, you can see some of the programming that YMCAs were doing specific to older adults just before the pandemic that really helped engage and provide social connectedness opportunities. And we oftentimes heard from YMCAs, even when Ys were closed due to the public health emergency, that sometimes our older adults were coming to the YMCA and sitting in lawn chairs in the parking lot as a way to continue to stay socially engaged. Also, YMCAs conducted a lot of wellness checks with older adults, which included everything from calling, phone calls for those check-ins, as well as getting people access to our food programs or even medication related services. So lots of different ways in which we've been delivering older adult services And then the next slide talks a little bit about what we've been learning through this. So we've partnered with different organizations to look at the social connectedness that we're seeing across some of the programs that YMCA's run. This is a project that was conducted in 2018 with support from the AARP Foundation, where we wanted to see if our group-based chronic disease programs really improve social connectedness or was sustained following those programs. And if we go to the next slide, you'll see that we did see a statistically significant difference for those. We used Duke's social, oh my gosh, I'm gonna mess up the acronym, but we used this social connectedness scale to assess this. And we saw that for those who had a low DSSI score at the start of the program, we did see a statistically significant difference at the end of the program. So this isn't one example in one measure that we use from chronic disease programs that were really focused on the lifestyle change. And then if we go to the next slide, we then wanted to go a little bit further. So we worked with NORC to look at older adults who might be coming to the YMCA just for membership, or YMCAs or older adults who are coming to the YMCA for chronic disease programs. We wanted to see if there was a difference between those two groups. And if you go to the next slide, we'll see a little bit. We used different measures this time around. We used some quality of life measures that came from 100 Million Healthier Lives, as well as UCLA's loneliness scale. And we did see significant improvements across variables like overall well-being, social connectedness, loneliness. And then we also saw that dose matters. So on the next slide, you won't be surprised probably to know that the more people attended, the higher their social connectedness was. So that's really important for us to keep that in mind. In both of these projects where we were doing this, the average age of the respondents to the surveys was 69 years of age. And in the AARP Foundation project, it was 80% female who were responding. And in the NORC project, it was 77% female who were responding. So maybe not surprising to all of you, but just wanted to share that. Next slide we're starting to talk a little bit about partnerships. So as we were preparing to share a little bit about what YMCAs have been doing, I reached out in our network and said, hey, tell me what's going on. What are you doing in partnership either with AAAs or other aging agencies in your communities? And this is only a handful. So there's a lot of responses, but our next slide shows 5 different examples, and I'll be very brief because I know we have other great speakers to share here, but just a couple different examples. So in Fort Worth, Texas, the YMCA there partnered with their AAA around falls prevention starting back in 2019. And that helped the YMCA work with the AAA to launch Enhanced Fitness as both an arthritis management and falls prevention program to support older adults in the Fort Worth area. In Indianapolis, they worked with their AAA and they've been able to support the delivery of the diabetes prevention program for the last several years to approximately 50 to 60 individuals. So it's allowed those folks to participate in the program. In Eau Claire, Wisconsin, they worked with their local ADRC dementia specialist, and they actually created a program focused on brain and body fitness for individuals with moderate dementia and their caregivers. So we've even seen some program development based on community need in partnership with different agencies. In Tacoma, Washington, they worked with several county agencies on aging, as well as their Department of Health, to connect people to falls prevention programs, whether it's in the Y or other community organizations. And they also engaged individuals in a service the YMCA there has called the Community Cafe, which really focuses on connecting older adults and caregivers to the virtual community of health, wellness, as well as connection. And then my last example here is from Sacramento, California, where they worked with their Alzheimer's Association and one of their health systems to offer a workshop. So they have a variety of health workshops available at no cost throughout the community because they're supported and subsidized by the Y and these partners. And then also a grant opportunity that Kaiser has allows the Y to offer some stretch and balance programming for falls prevention. So a lot of different ways in which YMCAs are working with aging network partners. Again, this is only a handful of examples. I'm sure if there are YMCAs on this call, they would all be raising their hand and saying, "Oh, but we do this here and we do this here." So my last slide, or my next slide, sorry, gets into how do you how do you find out more? How can you learn about what's happening and the YMCA maybe in your community? So first of all, go to ymca.org to find your nearest YMCA. Reach out to the health and wellness director at that YMCA, get a sense of or go to the WISE website, find out what they offer for older adults in the community, find out who they might be partnering with already. Share information with those YMCA colleagues on the work you do to support physical activity and social connectedness, and how the Y might be able to connect and support your work. And then explore opportunities to collaborate within your community. Are there ways that the YMCA can attend meetings or events or participate or your organizations engaged with YMCA hosted events? One of the things that we really have been trying to focus a lot on is how we ensure that we're actually meeting community need and involving the community in the development of whether it's programs or services that really truly are rooted in what the community needs and developed with the community. So there's lots of ways to engage with your local YMCA. If you're wondering who's the best person at your Y to reach out to, oftentimes there's a director of health and wellness, so it might be your best starting place. And then the last slide, I think, is just a thank you slide. It is, so that's my contact information. If you have any questions, you can feel free to reach out. You feel free to reach out and make sure that you have an opportunity to engage there in order to learn a little bit more. Or if you have a question and you're trying to reach a specific YMCA, we can facilitate getting you connected to that YMCA. So with that, I'm excited to turn it over to Jennifer from NCOA, who's going to take over next.
Great. Thank you, Heather. So good afternoon, good morning, everyone. My name is Jennifer Tripkin. I am a director at the Center for Healthy Aging at the National Council on Aging, and I'm excited to talk to you today about some of the strategies, some of the activities and partners that we've seen through offering physical fitness evidence-based programs and social engagement. Next slide, please, Allie. So today I'd like to just talk about a few items. My general overview in the next 15 minutes, I want to share a little bit about the National Council on Aging and in particular the Center for Healthy Aging. I'm going to share a quick overview of evidence-based programs, including how to search for those programs and how to review the different programs and choose the one that's right for your community. I also want to share some data on evidence-based programs with an emphasis on that social engagement piece, as well as share resources that are available in case you wanted to learn more. Next slide, please. So the National Council on Aging was founded in 1950, and we were one of the first charitable organizations in the United States that advocated for older Americans. Our vision is a just and caring society in which each of us, as we age, lives with dignity, purpose, and security. And our overall mission is to improve the lives of millions of older adults, especially those who are struggling. We have a very big goal of impacting the health and economic security of over 40 million older adults by 2030. And we have particular subgroups that we're particularly focused on. In fact, our key focus areas include healthy living as well as financial security. And our key audiences are older adults, caregivers, professionals, and advocates. Next slide, please. So through our focus on improving the lives of older adults, the work we can do can best be summed up in 4 key areas. The first is we provide trusted, unbiased information in the form of different resources that we want to have available that enables not only older adults and their caregivers, but professionals to take steps to improve their quality of life. We offer best practices through the form of technical assistance and support to professionals and communities who serve older adults. We also have a wealth of tools or personalized online support for individuals around economic security as well as healthy living. And we are very engaged in advocacy, and we are a national platform and voice to fight against ageism and to strengthen the federal programs we all depend on as we age. Next slide, please. My unit, or the Center for Healthy Aging, is part of the National Council on Aging, and our work focuses on supporting evidence-based health promotion and disease prevention programs in the community as well as online. We collaborate with national, state, Allie, if you can go back one slide, thank you. We collaborate with national, state, and community partners, and we actually house 3 national resource centers that are funded by the U.S. Administration for Community Living, Administration on Aging. And this is the National Chronic Disease Self-Management Education Resource Center, our National Falls Prevention Resource Center, and the new Modernizing Senior Center Resource Center. My work primarily lies within the chronic disease or the CDSME and falls prevention resource centers. And through this work, we seek to support organizations as they implement, evaluate, and try to sustain their evidence-based programs in the community. We provide support across the aging network, but in particular to those ACL discretionary grantees to implement these programs through technical assistance, webinars, monthly newsletters, and more. Next slide, please. So a major aspect of our work is to support the expansion and sustainability of evidence-based programs. And so I want to share with you just quickly a little bit about these evidence-based programs and what makes them a little bit different than other programs available. First is that they offer proven ways to promote health and prevent disease among older adults. They're based on solid research and provide documented health benefits. So those who are offering these programs in the community can be confident that they work. Older adults who participate in these programs can lower their risk of chronic diseases and falls, and also improve the long-term effects of chronic disease and falls in their life. So like I mentioned, evidence-based programs have solid research to support them. They're based upon rigorous study of the effects or outcomes of specific programs. So they've been able to demonstrate both reliable and consistent positive changes over time and in older adults. These programs are also packaged programs. And what that means is that they come in the form of handbook and manuals. They have a strong emphasis on fidelity. So there's consistency across all settings, and it's easy to deliver. These packages usually do include implementation manuals and specialized training. And there are a ton of benefits to offering evidence-based programs because of the solid research and because of the high fidelity nature of them. First is that they can reduce chronic diseases and falls. They've been demonstrated to show the improvements in those particular areas. They're also important to community partnerships. Many community organizations and healthcare entities can partner to implement evidence-based programs, making that essential community clinical link stronger and integral to part of the good health of older adults. Next slide, please. So evidence-based programs are supported by the Older Americans Act, otherwise known as OAA, and the states that receive OAA funds under Title III are required to spend those funds on evidence-based programs to improve the health and well-being of older adults and reduce disease and injury. Now, since 2003, the Aging Network has been steadily moving towards wider implementation of these disease prevention and health promotion programs that are based on the solid evidence like I just discussed. So on this slide, I've provided the links to both the evidence-based programs that meet that Administration for Community Living's criteria to cross that threshold of what it means to be evidence-based to be eligible for these Title III funds under the Older Americans Act. And I've also included a link here to a search function that we have on our NCOA website. This includes not only information about each and every program, but you can easily download a chart or a PDF that includes the descriptions of each program, the different costs of each program, the contact information of the program developers, as well as program goals, the target audience, and different training requirements. So this is a site that I'll share in the chat as well, the link for this, but it could be important if you're interested in the breadth of evidence-based programs that are out there. It really does give you a sense of what's available as well as the different requirements of the programs. Next slide, please. So on this slide, I just share with you a few of the evidence-based programs. By no means is this exhaustive, but these are some of the more common evidence-based programs that we have available. Virtually all can be delivered in different forms, whether it be in person or online, telephonically, or by mail. So there's a lot of flexibility with these programs, and hence that's where that search button comes into play that helps you start to narrow down the different features of the programs. So under the chronic disease self-management programs, we have a suite of CDSME programs which were developed by Stanford University. These include the traditional chronic disease self-management education program, which can also be delivered in Spanish, as well as diabetes self-management program, chronic pain self-management program, amongst others. There are also behavioral and mental health programs such as Paroles, the program to encourage active and rewarding lives to combat depression in older adults. Under the falls prevention side of things, there are also a number of different programs, some in which Heather mentioned, including enhanced fitness, a matter of balance, stepping on, Tai Chi's, and bingo size, among others. So I encourage you, if you're not familiar with evidence-based programs, to check out that search button, or even if you are, to see what's newly approved and what's new on that list and emerging. Next slide, please. So I wanted to share with you just a little bit of information about the impact of these programs, just to give you a sense of not only how are they impacting older adults, but also who is participating in them. So on this slide, I provided some information we have from our national database, and this database is from discretionary grantees. So by no means does this represent the full breadth of evidence-based programs that have been delivered. It really is just a subset, but I think it gives you a good idea of who's participating and some of the outcomes with that. In fact, since 2010, when we first started this database, we've had more than 480,000 older adults who've participated in these programs, and as well as being offered across 43,000 workshops. Now, I put in here a chart on the left side, the top sites where these are offered. So you see here, there's a number of different sites from healthcare organizations, senior centers, residential facilities, as well as some other facilities such as the libraries, rec centers, YMCAs, hotel conference rooms, even in the back of grocery stores where these programs can be offered. But the top spots tend to be primarily in healthcare organizations, senior center, and residential facilities. I also want to give you a sense on the right side of the page here of who is participating. So a little bit of the characteristics of the older adults. So we know the average age of those who participate in a CDSME program is around 66 years old. They're mostly female and white. And we see a little more than a third of participants are caregivers, and they also report being in fair or poor health. Next slide, please. This is an outcome slide for you, some other information about participants of CDSME programming. We know that more than 79% of older adults have at least 2 chronic health conditions. And here on this slide, you see that the average number of health conditions of these CDSME participants is a little bit over 2.5, with the most prevalent health conditions being hypertension, arthritis, high cholesterol, diabetes, and chronic pain. I also pulled a little bit of data on loneliness. We don't have a ton of data on this because we don't ask this question. We've only started to ask this question in the last few years. Actually, I think it began right before the pandemic occurred in 2020. So I thought it would be interesting for today's discussion as it's an element of social engagement. And as we see on the bar chart, about half of participants who completed the survey associated with the programs experienced no change in their loneliness, so it was maintained, which is not a bad thing. And in fact, for some, their score went up, but for others, they reported a score that went down. So I just want to caution us with this here, that we take into context. We only started to ask this question around 2020 onward, a time when there were lockdowns and big impacts on social isolation and loneliness. But put in another way, 67% of participants in CDSME programs either maintained or improved their their loneliness score. And other research on individual CDSME programs have shown that there's been an impact on social engagement. Next slide. I also want to share with you briefly just a bit of information about the falls prevention programs. So this is pretty similar to the other slides that I've shared, but there are some key differences. We have collected data since 2014 on ACL discretionary grantees who offer evidence-based falls prevention programs. And there's been about 172,000 participants across more than 14,000 workshops. We see the average age of people who engage in falls prevention programs is pretty much older than the CDSME programs. In fact, their average age is around 75 years old. They are, again, mostly female and white, and about 70% reporting having one chronic condition. Next slide, please. And some outcome data on evidence-based programs. I wanted to share with you on the top left, far left of the screen in that, in the pie chart. About 63% of falls prevention programs report their loneliness stayed the same, while about 20% noted an increase in loneliness. So this is a little bit of a contrast to the CDSME programs, which are somewhat conversation-based and cognitive restructuring-based and action-oriented. Our falls prevention evidence-based programs tend to have elements of exercise or physical activity. And we do see that there is a difference in some of the outcomes. Not to say that there is a direct causal relationship between the two, but it's an interesting trend to see. I also shared a little bit of other outcomes just of interest here for you on the falls prevention programs. Those completers of those programs have some really remarkable outcomes on their falls risk. So you can see here about 96% of older adults who complete these programs feel more comfortable talking to their healthcare provider about falls, as well as talking with family and friends about falls, which is an important part of falls reduction. And also on the second line there, about 97% of participants felt more comfortable increasing their activity as a result of the program, and 99% plan to continue to exercise. Next slide, please. So specific to today's webinar, evidence-based programs offer an immense potential to enhance the lives of older adults in terms of the hook of social engagement through our physical activity of falls prevention programs. And we know that physical activity is not just about keeping the body moving, it's just a real powerful hook to foster that sense of community. So we know that physical activity programs serve as a catalyst because they a catalyst for social engagement because they have a common goal for participants. Whether it's an exercise class, whether it's a walking group, engaging in these activities creates a natural platform for that conversation and connection. Engagement in these physical activity classes or evidence-based programs tends to establish a routine that encourages consistent interaction over time, in which participants become familiar with each other, which may lead to friendships and beyond that. So most of our evidence-based programs are not just one-time occurrences. They occur in 6-week blocks, 8-week blocks, and even longer. So having that consistent interaction does facilitate that social engagement. And we also know that physical activity programs inherently promote mutual support and encouragement, whether it's to cheer each other on, celebrate milestones, offer motivation during those challenging classes. It really does strengthen that sense of camaraderie. So one of the key challenges that we hear when supporting those communities across the country and offering programs, amongst others, is recruiting participants. So I wanted to share with you links to a few new resources that we have that offer social media toolkits to help recruit older adults into evidence-based programs. So I've included them here for you to see that we've kind of have prepackaged messaging. And we also have a number of videos that link in together. So on the next slide, I wanted to play for you just a 2-minute video that is something that you can use that may facilitate that hook of engaging in programs while increasing social engagement. Allie?
Fall prevention is so important for seniors. It is the main thing that causes injuries to seniors. As we age, our ability to stop a fall or just not fall, it's really hard.
The good news is that thousands of older adults have found that programs to improve strength, balance, coordination, and mobility can help prevent falls. Falls prevention workshops are offered in a variety of locations across the country.
Learning that movement is important, and the more you move, the less likely you are to make sudden falls. So that was my motivation for taking that fall prevention workshop.
And this whole program that I teach can be done seated. And you can do everything that we do standing up, sitting down.
Falls prevention programs are more than just exercise. They help with improving balance, strength, movement, and flexibility. They also provide valuable tips on how to keep your house safe and free of trip hazards, how your medications may increase your risk for falling, and how to overcome a common problem, that is the fear of falling.
When I took the class, I made sure that I did not leave things on my steps in the house so that I could trip over them, making sure the rugs are secure. So it did make me more aware, but I think the biggest thing was, okay, people do have some control.
These courses are transformational because over a period of 6 weeks, you can see a remarkable difference in the lives of some of the participants.
But I really think that the secret sauce for these programs is in the support that participants provide to one another, in the sharing of tips and strategies during the classes.
I remember the first time that we were able to dance together after the surgery and after going to Enhanced Fitness. It was just such an incredible feeling to be able to do that after going through all the months of exercise and getting the body ready for the next stage.
Stay independent. Stay falls free. Learn more at ncoa.org/falls.
So some key takeaways of this video that I thought were important. While it focused on recruiting participants into falls programs, one of the primary motivations that we heard for joining a falls class is to reduce falls risk, not necessarily to increase our social engagement, but as someone said on there, the secret sauce of these programs is really about the social support that occurs with them. We saw in this video that classes can be offered seated as well as standing, so it applies to a variety of abilities. So I wanted to share that with you. This is available for you to embed, to download, to share on your social, to embed on your website, and we have a number of different videos. Next slide, please. So in sum, I'd like to share with you a few resources that we offer that might be of interest. First is we have a best practices clearinghouse of resources, tip sheets, tools around increasing capacity for and sustainability of evidence-based programs. This offers a plethora of resources from leader recruitment and retention, developing strategic partnerships, marketing and recruitment templates, to strategies for sustainability. And right in the middle there is a webinar. We host a number of different webinars, but a standing webinar that is very relevant to evidence-based programs, tackles a number of key issues, is our Grand Rounds. This is a monthly webinar that's been running since 2020, and it features those organizations around the country have offered evidence-based programs. They share resources. It's a source of collaboration and brainstorming, just a great way to network across the nation and to make connections. And finally, I've included on the last bullet here a link to our landing page for evidence-based programs. It includes information about every evidence-based program available, as well as ways to search and decide on what program is right for you. Next slide, please. So I'd like to wrap up and providing my contact information here. Please visit www.ncoa.org, or please feel free to reach out to me via email. I'm happy to answer any questions. So with that, I will hand it off to our next speaker from the National Park and Rec Association, Sina.
All right, thank you, Jennifer. Hi, everyone. Great to be here with you all today and excited to share more about the work that we're doing at NRPA. Next slide, please. For a quick introduction, my name is Sina Macris. I use she, her pronouns, and I am a program specialist on the health and wellness team at the National Recreation and Park Association. My background is in public health, and I work very closely with our healthy aging portfolio. Next slide, please. For those of you that are not as familiar with NRPA, for a little bit of context, NRPA, the National Recreation and Park Association, is the leading nonprofit dedicated to building strong, vibrant, and resilient communities through the power of parks and recreation. We work to advance this vision by investing in and championing the profession as a catalyst of positive change for equity, climate readiness, and health and well-being. Through our work, we seek a future where the full power of parks and recreation is widely recognized for creating a better life for everyone. Next slide, please. So I mentioned the phrase, the power of parks and recreation, a few times already, but what is it exactly that makes parks and recreation so powerful? Next slide, please. For one, parks and recreation is vital to community health and well-being. Park and recreation agencies all over the country play a huge role serving as community wellness hubs, meaning they represent trusted gathering places that connect every and all community members to essential resources, programs, services, and spaces. And by doing so, park and recreation agencies are able to advance health equity, improve health outcomes, and enhance the quality of life for all. Next slide, please. So on this slide, I've highlighted some key statistics that reflect the public's perception of parks and recreation. To share just a few of these, in 2022 alone, 275 million people visited a local park or recreational facility at least once. In terms of parks and recreation being essential, 93% of US adults believe that parks and recreation are essential to their physical and mental health. You can also see here that 92% of US adults look to parks and recreation to provide activities and programs for older adults. And then there's the benefits. Those that use parks and recreation are 3 times more likely to achieve their recommended levels of physical activity and are more likely to experience improved mental health. Next slide, please. Now focusing specifically on older adult programming, NRPA recently conducted a Healthy Aging in Parks survey, and from this data we gathered the statistics that are reflected here on this slide. You can see that 92% of agencies offer facilities or programming dedicated specifically to older adults, and I'll go over a few examples of these offerings in the following slides. You can see that 76% of agencies offer 1 or more evidence-based programming to older adults, and 71% of agencies characterize themselves as the leader or one of the leaders providing services and programming for older adults in the community. Next slide, please. So here you can see the most common activities or programs for older adults offered by park and recreation agencies. The first one here and the most common offering is exercise classes. 91% of park and recreation agencies offer exercise classes to older adults. The most popular classes are evidence-based programs focused on diabetes, falls prevention, and arthritis management. For example, some agencies offer Tai Chi for arthritis or Walk with Ease in their communities, which are evidence-based programs meant to support older adults with chronic conditions like arthritis, but also supporting them by providing those social opportunities. Some other activities you will notice here include field trips, which can mean a museum tour, it can mean a weekend trip, or even a visit to a local winery. You will also see arts and crafts classes as a popular offering, giving older adults that opportunity to creatively express themselves or learn a new hobby with their peers. A handful of park and recreation agencies also offer volunteer opportunities and hold special events or festivals that specifically prioritize older adults. Next slide, please. So what do we do at NRPA to support this work and our agencies in this space? For one, NRPA promotes the expansion of evidence-based interventions. We offer instructor training grants to agencies, allowing them to implement evidence-based programs for older adults in their communities. This also included virtual implementation during the pandemic. We also support communities of practice that teach park and recreation professionals how to center equity into their healthy aging programs and policies. We have done research and collected data to analyze the impact of park and recreation programs and have supported partnership building to expand older adult programming in all communities. Next slide, please. Now, this all sounds great. Park and recreation agencies are excellent providers of older adult programming. What could possibly be the problem here? Well, as you can see in this graphic, park and recreation agencies face many challenges that impact their capacity to support older adults. For one, park and recreation agencies still work with relatively small operating budgets for older adult programming, regardless of the many benefits. Other challenges that you can see here include staffing and facility shortages, among many others that are reflected in this infographic. So this is the bad news. Next slide, please. But the good news is that park and recreation agencies are not alone when developing and delivering older adult services. There are many other community-based organizations or external partners that work with park and recreation agencies to make these offerings possible. In fact, around 92% of park and recreation agencies partner with outside organizations to better serve the older adults in their communities. Next slide, please. So really any organization can partner with Parks and Recreation, but this slide here shows a few of the most common partnerships that support healthy aging. The most common, with 63% of agencies partnering with, is Area Agencies on Aging, or AAAs. Other frequent partners include community-based organizations such as the YMCA, retirement communities, senior centers, meal providers, and health departments. And this list really only highlights a small portion of potential partnerships. There are so many other partnerships out there that exist that extend well beyond this list. Next slide, please. All right, so in the next few slides, I have highlighted 3 different park and recreation agencies that have wonderful partnerships in place to support their healthy aging work. So let's get into some of those examples. Next slide, please. Great. First, we have Detroit Parks and Recreation in Michigan, who was recently recognized in the Physical Activity Guidelines for Americans Mid-Course Report for their work in the healthy aging space. Currently, Detroit offers older adult programs and fitness classes at 12 recreation centers across the city. Many of these are evidence-based programs, for example, Walk with Ease and Fit and Strong, and have had a powerful impact on increasing physical activity levels, but also social connections among older adults. Participants report loving the fun nature of the classes, as well as opportunities to interact and engage with new and old friends. In addition to hosting these classes, Detroit also manages over 300 parks, many of which have walking paths for community members, such as older adults, to use. And the key here is that Detroit doesn't work alone in this space. Detroit has a wonderful partnership in place with the Detroit Area Agency on Aging to support senior-specific events, programs, and festivals. One popular event held in collaboration with the Area Agency on Aging is Senior Friendship Day, which is an annual celebration held for all older adults in the community. And it features things like music, dancing, exercise classes, and fun times with peers. Next slide, please. Next up, we have Philadelphia Parks and Recreation in Pennsylvania. This recreation department has a long-lasting partnership with the Philadelphia Corporation of Aging and includes sharing resources and facilities, working together on partnership, participant recruitment and marketing for programs, and assisting with the securing of funds. It also includes collaborating on exercise programs and lifestyle classes. You'll see some of the additional benefits and offerings listed here on this slide, but really a great mutually beneficial partnership. Next slide, please. For our last example, we have Newport News Parks, Recreation, and Tourism in Virginia. This department partners with the Peninsula Agency on Aging to implement their Active Lifestyles program. This program is specific to adults ages 50 and up and offers exercise programs, educational workshops, and community events and trips for older adults to engage in. The Peninsula Agency on Aging has supported the Active Lifestyles program for over 20 years, and the partnership includes recruiting program instructors and participants, marketing and promotion for events, and the sharing of facilities and resources. Next slide, please. All right, so those were 3 examples of partnerships that currently exist between park and recreation agencies and external organizations that also prioritize older adults. So another question you may have is, how do you initiate a partnership with your local park and recreation agency? To answer that, I've provided 4 quick tips listed here on this slide to get you started. Tip number 1, attend events that are hosted by your local park and recreation department, whether that is community events, fairs, or even meetings that are led by Park and Rec Voices. And this applies vice versa as well. You should invite park and recreation professionals to attend your events. Number 2, take the time to tour the parks and recreational facilities managed by your local parks department. Whether that is a scheduled tour or a self-guided tour, encourage yourself to learn more about the field and the work that your local department is currently doing. Again, invite park and recreation professionals to learn more about your organization as well. Number 3, welcome park and recreation voices to the decision-making table. This might be advisory boards, task forces, or committees. This is a great way to start a conversation and can lead to a partnership. And lastly, number 4, explore like-minded goals. Without even knowing it, your organization's values, goals, and desired outcomes may closely align with those of the Park and Recreation Department. So take the time to learn more about an agency to determine where there is alignment. Next slide, please. So you have the tips, but now you might be wondering, where do I fit into this? Or how can my organization support a park and recreation agency? So on this slide, I've outlined a few topics that are recognized as areas where park and recreation agencies seek additional resources and support from external partners. These include marketing and outreach, intergenerational programming, funding, evidence-based programming, providing services to those with different abilities, or even creating volunteer opportunities for older adults in the community. Again, this list does not highlight all areas of interest, but seeing a few of these might help you determine where you can fit into a partnership and what skills or resources you could bring to the table. Before closing out, I'll share a few quick final tips to help ensure sustainability in a park and recreation partnership. 1, establish clear goals and expectations early on in the partnership to ensure alignment. 2, include community members and voices in planning and decision-making aspects of the partnership to be sure your objectives meet the needs of the community. And lastly, practice effective communication to build trust and reliability. Next slide, please. Just want to highlight as I wrap up, we know that the demand to serve older adults will continue to grow, and we want to do everything we can to support that growth, and sustainable partnerships is an excellent way to do so. With that, thank you for allowing NRPA to speak and share today, and please don't hesitate to reach out to us with any questions. Turning it back over to you, Rebecca. Thanks again.
Thank you so much. Thank you to all of our speakers for those terrific presentations. Before we move to questions, I did want to highlight a few quick resources from Engaged. So Engaged recently released a Connecting Generations consumer brochure. We developed this in partnership with the Elder Care Locator and with contributions from Generations United. And this brochure provides older adults with information on the benefits of intergenerational engagement, examples of types of intergenerational activities, and then resources to find activities within their community, sharing the places and the spaces where they can find those. In all three of YMCA, senior centers, and Parks and Rec agencies were all highlighted in there. Engaged also recently released the 2023 What Works Social Engagement Innovations and Best Practices publication. This publication spotlights a range of social engagement programs that employ a variety of different interventions and tap into an array of partners to reach consumers. And we also hope you'll check out the Engaged Community Awareness Toolkit, which we relaunched with new and updated materials. The toolkit contains customizable materials so you can add your logo to those, including a consumer brochure, infographics, fact sheets, a PowerPoint presentation, sample newsletter, and social media language, and more. And we also have an array of other resources, including our Social Engagement Innovations Hub, which is an online clearinghouse of social engagement programs that facilitate shared learning and replication. This is a great place to get inspiration for your social engagement programming, and we also would love to spotlight your programs as well. So you can visit our website to learn more about that, read the program examples, and see how you can submit your own programs. And we also have some virtual and hybrid programming manuals, more consumer brochures, and other resources that can help support your work on social isolation and loneliness. So our website is a great place to start. All of our resources are free and publicly available. Next slide. And then we also wanted to share one more initiative focused on social engagement. Commit to Connect is a campaign developed by the Administration for Community Living to combat social isolation and loneliness. This initiative is working to foster a nationwide network of champions at the local, state, and national levels who are committed to addressing social isolation and loneliness. So I think everyone who's attending this webinar is a champion and should consider joining the nationwide network of champions. So by joining that, you can participate in an online networking platform, and you have access to online discussion threads and events and opportunities that will help support your work in this space. And US Aging serves as the coordinating center for the Commit to Connect initiative. So I'd encourage you all to check out the Commit to Connect website as well. That URL is on the screen. It's just committoconnect.org, and join the nationwide network of champions. It's a very straightforward, free, no cost sign-up process, and it's a great way to connect with your peers who also care about addressing social isolation and loneliness and promoting social connection. Next slide. Okay, so we now have about 10 minutes, or a little bit less than 10 minutes for Q&A, so I'll invite all the speakers to turn their webcams back on, and we'll take the slides down. And I want to look, because I know there was one question. Allison answered it in the chat, but so Sina, if either you or Allison can talk to this about the NRPA grants, if you guys can just maybe share a little plug about what's coming soon, and maybe share the link in the chat as well.
Absolutely, I sure can. So Allison shared the link, I think, in the Q&A section, but I'll put that in the chat as well. NRPA is opening a new grant opportunity come September. So essentially what this grant will provide, it will provide instructor training grants and participant materials to Park and Rec agencies around the country. So we offer 5 different arthritis appropriate evidence-based interventions through this grant, which is funded by CDC. We offer Tai Chi for arthritis, enhanced fitness, fit and strong, walk with ease, and active living every day. So through this grant, our grantees have the opportunity to receive instructor trainings, learn best practices around ABI or arthritis appropriate evidence-based programming implementation. And they'll also kind of have an opportunity to explore health equity focused opportunities, including how to implement health equity programs and policies into their arthritis programs.
Thank you. And okay, so this is kind of a two-part question. So first it'll be for Heather and Sina, and then Jennifer will have another question for you. But so you guys both offered great tips about partnerships and getting started. So for those who don't have an existing relationship with their local Y, for organizations, I should say, that don't have an existing relationship with their local Y or their Parks and Rec agency, if there's just one tip for getting started, one thing that you think is most important, you know, is it just having an informal conversation or attending, you know, events? Is it being maybe a little bit more purposeful or intentional about having like a thought out process about ways you could partner and then going into a conversation? Is there just like one tip you'd recommend for people to get started? Heather, you want to go first?
Yeah, I can go first. I think just reach out. Like, I don't know that you have to go in with a full list of here's all the things. I think it's a matter of saying what you do and where there are opportunities to connect, and then finding out what the Y does, and then where there might be opportunities to cross promote. So I think just making that initial outreach. If you you can always start with the leadership of the YMCA, but oftentimes you can also just go straight to the health and wellness director.
Yeah. Sina?
Heather, I totally agree. I think those informal conversations are everything. I'd also say just physically going to your park and recreation agency or your local department and observing events, or even engaging in conversations with users of park and recreation departments and facilities, I think is a great way to determine where your priorities and your goals align. And that is a great way to build a partnership.
Thank you. Okay, and then Jennifer, for organizations that are interested in running their own evidence-based program, what's just like one tip for getting started, one thing they should do first, check out first, go to first? What would be your one tip?
Sure. I would say go to the search. There's a number of evidence-based programs that are out there that there's a lot of benefits to them. They're based on solid research, they're pre-packaged, but they're all different. And you want to make sure that program not only meets the needs of your community, but meets the needs of the organization who's going to be hosting that program. So whether it is a 3-week program, a 6-week program, or even longer, what are the costs associated with that? What is the staff time? All these decisions are important. And so going to the search, kind of narrowing down, getting to see what's available. I think that might be one of the first steps. And one of the most important steps is identifying the need and then also trying to find a program that matches that need.
Great. Thank you so much. Okay, I know we're almost at the end of our webinar close time, so I'm going to have Allie bring the slides. One more slide up for everyone really quickly before we close out. Okay, thank you so much. Okay, so I just want to again thank our speakers. Thank you so much for your time, for sharing your expertise and your insights with all of us. And for our attendees, thank you so much for joining us today. There is going to be a survey that'll be displayed in your browser right after the Zoom closes. So please do take a moment to complete that. Your feedback is so helpful for our future webinar offerings. So thank you in advance for that. And there also will be a brief 3-month touchpoint survey, since we like to look at the longer term impact of our webinars as part of our work plan for our grant. Again, the recording of today's webinar and a PDF of the slides will be available on the Engaged website soon, and a link to where you can access that will be shared in the follow-up email. Thank you all so much for joining us, and I hope you have a great rest of the day.